do so.
That's fine. Sure, that's fine. No, I'm honored that you would record it. That's fine. Well, so today, first of all, I want to thank Dr. Myers for inviting me to speak with you. I'm a doctor, I'm a psychiatrist, and I also had many years of psychoanalytic training. And right now I'm a professor of psychiatry at Eastern Virginia Medical School. And I also am a senior analyst at the Washington, D.C. Contemporary Freudian Society. So I do a lot of teaching. And today I thought that I would introduce you to some modern analytic concepts about understanding people. All right, so, and understanding people, we use the term diagnosis. We're really just trying to see what goes into mental functioning and what can go wrong. Right? And the first thing to know is that everybody has conflicts. Everyone, normal people have conflicts, schizophrenic people have conflicts, and everybody in between. What are the conflicts about? Well, we all have, for example, wishes. So there's a lot of analytic theory about where wishes come from. But it's kind of common sense that people wish to eat, right? They have these are all pleasurable wishes, right? And pleasure is a big part of it. About 130 years ago, Sigmund Freud actually came up with something that was right, and he figured out that there was something called the pleasure principle, that people tend to move towards things that are pleasurable and away from things that are unpleasurable. He changed that idea about 30 years later in the 1920s when he ran into people who were sadomasochistic, and they seemed to want to move towards pain. That's a whole study. If you want to ask me a question about it, I'll be glad to answer it. But anyway, so we all have what are called oral wishes. They come from the first year of life. And that's a wish to be taken care of and fed and listened to, stuff like that. This is the reason that restaurants are so popular. Because if you go to a restaurant, somebody feeds you, they cook the meal, and they clean up afterwards. You don't have to do anything. And we're just like babies sitting there and somebody brings us the food. The only thing we have to do is put it in our mouths. Right? That's the only thing that's different from an infant. It's a very, very pleasurable activity. And we all wish to do it. Most of us wish to have people who care about us and pay attention. I think all human beings have some kind of sexual wish or another. That can vary quite a bit, but they're still involving sexual things. That is once we pass puberty anyway. Most people are aware of a hostile, destructive wish once in a while when they get angry. And sometimes we see it in people who aren't even angry. It's not due to frustration. Just look around the world and, you'll find leaders who seem to want to destroy other people, like Vladimir Putin. What is he doing? So we see this in certain types of disturbances, but everybody has some tendency towards them. Most of us have wishes for what Bowlby called attachment, where we actually have people who not only care about us, but form a sort of bond with us, a special type of bond, like in very, very intimate friendships, and of course in love relationships. Right? And finally, most of us have wishes for independence. Right? And that's based on something called object relations theory that I will talk with you about today. Anyway, these wishes can come into conflict. Notice these three arrows here. They can come into conflict with reality. So for example, a college guy might think, well, gee, I really like that girl. She's cute. And he starts having some wishes toward her, right? And he finds out, oh, she's dating my fraternity brother. Reality impediment. So when he's going to have a conflict, right? Because he wishes for something that's not available. And the idea is that conflict will produce an emotion. In this case, it might produce depressive affects, right? He'll be depressed because, well, he can't date the girl, right? She's already dating somebody. In some situations, he might get angry, but that would be unusual. All right. Wishes, say you have a wish to be independent, but your parents made you feel so guilty about it that you're still having conflict about it. You want to be independent. For example, I remember when my son was in college, one of his friends' parents told my son's friend, you can't be in that fraternity anymore because your grades are not high enough. So we're pulling out the money for the fraternity. You're going to have to live in the dorm. So they were still controlling him. And I remember he lived in the dorm, but he was very aggravated about it because they were interfering with his wish for independence. The reality got in the way, his parents paying for school, and that caused him to get angry. Right? Now, what did he do? He became passive. That's a defense mechanism. He put it out of his head. That's a defense mechanism called suppression. And he kind of did what his parents told him to do. In other situations, we see people who don't do what their parents tell them to do. They may get angry and they may rebel. All right. So another common wish is, say, a sexual wish towards someone that causes people to feel ashamed. So they don't express it right away. They're attracted to somebody, but they're too ashamed to say so. So they kind of wait around and hope that somebody else will introduce them or something like that. They'll use some defense because the shame that they feel about their sexual attraction causes them to feel anxiety. And because of their anxiety, they'll withdraw a little bit and hope somebody else will introduce them. So there are lots of ways this works. In psychopathology, I'm going to show you how it works when people have problems. We have to rely on this. But the basic idea is that everybody has some kind of conflict or another, right? And this is taken from a very famous psychoanalyst named Robert Welder, just for a little bit of historical perspective. I didn't make this up. He didn't make this. I made the star, but he came up with the idea. All of these things together are called a compromise formation. That's a term of art. So if you see somebody who procrastinates, for example, that would be a compromise formation. They're late on everything because they maybe have a hostile wish towards authority, but it comes into conflict with guilt. And so they come late to class, and what happens? And they don't do their homework because they have an oral wish to be lazy and a destructive wish towards their parents, but they feel guilty about it. So they mess up the reality. And guess what? They get punished, right? By the reality. They're going to fail the exam. Then they're going to get depressed because of all of this, right? And before you know it, they're in our offices complaining that they can't get out of bed in the morning and they're just playing video games all night, and so on and so forth. So we see this kind of construction. So the person is not going to class and just playing video games has actually got a compromise formation that's not so healthy. All right, if you have questions about this, we'll come back to it. Right? Yeah, so in phobias, you have this, all of these things involve these 5 conflicts. People usually have a wish to run away or something. And but they feel guilty about their wish to run away. So they project it and they use symbolization, and they're afraid to get into a car. Guess what? Well, if they got into a car, they would run away, right? And then they feel guilty. So the car becomes symbolic of their wish to run away. At the same time, it acts as a defense. It protects them from their shame and guilt about wanting to run away, and it stops them from doing it. All right. We also get the various types of obsessions. This is a joke about chocolate. I hope you think it's funny. There's a woman saying, I look engaged, but I'm really thinking about chocolate. All right. Now, when somebody's obsessed with something, that's a defense. Usually they feel guilty about some wish. In this case, it's the wish to eat chocolate. Most people feel a little guilty about it. And before you know it, they're ruminating about it. They keep dreaming of chocolate. Right? Insomnia is another compromise formation. People have disturbance of sleep, usually because they're upset about something. And here's the joke. No wonder you have insomnia, lying there awake all night. Yeah. All right. How about this one? I know I'm immature and lazy and obnoxious, but I'm still fun. This is a type, it's actually a type of personality disorder where people are lazy and obnoxious, and they usually get themselves in quite a bit of trouble. It's caused by conflicts here, usually hostile destructiveness, guilt, and shame, and they're upset about things, and they don't know any of that, they just misbehave. Now here's martyrdom. This is St. Francis of Assisi receiving stigmata because he felt very, very guilty, so he got punished. And the personality, here's a type A personality. Here's a guy climbing Mount Everest. And he's just, you know, what Sir Edmund Hillary said when they asked him, why did you climb Mount Everest? He said, because it was there, right? Type A. Well, here's a type B personality. He's a guy lying down in the valley. He's not climbing anything. And you ask him, why not? He said, because it's there. In other words, he's rationalizing about his laziness. All right, so you get all sorts of things that develop out of those conflicts. We're going to talk about all, these are 4 theories we're going to use today. I'm going to teach you a little bit about each of them. There's ego function theory, ego weakness theory, object relations and self theory, and superego theory, which is connected with what today we call conflict theory. It used to be called structural theory. You probably heard of id, ego, and superego. That's been updated for the past 30 years or so. We don't talk about id, ego, superego anymore. We're looking at drive, wishes, conscience, reality, emotion, and defense mechanisms. We call that compromise formation theory or conflict theory. So for those of you who want a reference about that, the guy who revised it was named Charles Brenner, B-R-E-N-N-E-R. Now, or you can look at my book, 101 Defenses. Operators are standing by. All right, now, here's my view of the mind. This is kind of how the mind works from a psychoanalytic standpoint. We have wishes that involve eating and dependency and oral things, sexual wishes, and of course, competitive or aggressive wishes. We have affects, that's emotions like anger, guilt, depression, anxiety. And then gradually over a period of time, we develop the strength to control these things, control and delay mechanisms. Right? And these control and delay mechanisms are called by psychoanalysts ego strengths. Right? So we talk about impulse control or tension tolerance or frustration tolerance. What are we talking about? The ability to contain these things so that we can think, right? So we can use these functions here, language, logical thought, memory, judgment, reality testing. We want to use these basic functions to relate to the world, the environment, people, right? We use basic functions to relate to the world. This other stuff is mostly going on unconsciously. Okay? So if we can't control things just with strength, which comes out of optimal, what I call optimal soothing during infancy versus optimal frustration as children get older. Right? Parents have to start frustrating them. At 5 months of age, the child cries, mommy brings him a bottle. Right? At 5 years of age, the child cries, mommy says, wait, sit down, we'll have dinner later. Little frustration. I understand you're upset, you're hungry. You can have a grape, and wait. We'll have dinner at 5:30. Right? So as children get older, we introduce more and more frustration, and from that they get a little stronger. They still need. Everyone needs soothing too. You know, get rid of that. Empathy and trust help, and eventually, out of empathy and trust, we get a superego. Right? So if you don't love somebody, you're never going to feel guilty. Right? And there are people in this world who never develop love for anybody, and they're dangerous. because they don't feel guilty. They can kill you just to get $5 out of your pocket. And they don't see you as a human being. Those are the most violent criminals. Right? But most people have a superego. It tells them, thou shalt do thy homework, right? And even though they're feeling lazy and they have oral wishes, they'll do their homework anyway. If that doesn't work, they'll use defense mechanisms to protect these basic functions here, like memory. Primary and secondary. Secondary process means logical thought. Abstraction ability means using metaphorical thought. Integration means organizing your thoughts, right? Using anticipating danger. That's another important function. And of course, making executive function means making decisions about yourself, making decisions about who you fall in love with, who you're physical with, or who you might fight, who you might argue with, right? Those are all executive decisions. All right, so that's an overall. We can come back to this if you have a question about it. Now, let's talk about basic functions. Even though everybody has conflicts, some people have something broken. And that's important to know, because we're all tempted to be psychoanalysts, right? Somebody has a problem and say, that's because his father treated him wrong or something. Well, he really is thinking this, right? But sometimes we see people where part of their mind really has broken down. So the term nervous breakdown is really not a bad term, because it's not the nerves that are breaking down, but something's breaking down. And the things that we see broken down in very severely ill people, typically one is reality testing. So they can't tell their fantasies from what's real. Now, that develops over a period of time. I mean, 2.5-year-olds have trouble with this too. I mean, they may believe that, the toy animal is real or a story is real, but in adults, most of us can judge what's real from what isn't real on a gross basis, although people argue about it sometimes. And here's a picture of Salvador Dali, who had some problems with reality, but he was very talented, and he could actually depict his disturbed reality testing in paintings. And they're found. I love Salvador Dali paintings. But here you have him standing on the roof of his house, pretending to be a conductor, and he's got an egg on the roof. I mean, not in touch with reality. And you see people like this. I once had a patient who wouldn't talk to me. She was in the hospital. And this was a long time ago. So let me see if I can find a current reference for it. It would be like, let's see, who's current? Well, I'll tell you the story. She kept hinting around that she thought I was Frank Sinatra. Now, Frank Sinatra, for those of you who don't know, was a famous singer. And his daughter, Nancy Sinatra, was also a singer. And she made a kind of famous rock and roll song called These Boots Are Made for Walking. And my patient kept saying to me, how's Nancy? And I didn't know what she meant. So finally she said, Frank, Nancy, these boots are made for walking. And I finally figured out she actually believed that I was Frank Sinatra. I couldn't convince her that I wasn't. So she had a problem with reality testing. Right? And when people have big problems with reality testing, we have a word for them. We call them psychotic. 150 years ago, they used to just call it insanity. But anyway, these are people who have breakdown in reality testing. And they can still have conflicts, but their reality testing is shot. And it's usually broken down in some area, right? So I don't know if you remember this, John Hinckley, who's been in the news recently, John Hinckley shot President Reagan in 1981. He did it because he believed that the actress Jodie Foster would fall in love with him if he killed Reagan. And he had no reason to believe this. He had had no contact with Jodie Foster. So he had a delusion, right? And he believed it. But he knew what a gun was, and he knew what hollow point ammunition was. and he could read the newspaper, and he knew who Reagan was, and he knew that shooting a gun at Reagan could kill him. So some areas of his reality testing were pretty good, but there's this other area where it's completely damaged. And that's what we usually see in psychotic people. Abstraction ability is another major function, which is also damaged in very severely disturbed adults. Of course, children don't have much abstraction ability. That's the ability to understand symbolism and metaphors and things like that. So I once asked a woman in the hospital, I said to her, "What brought you to the hospital today?" And she looked at me, she said, "The bus." That's what brought her to the hospital. And if you ask a person who has concrete thinking, which is the opposite of abstraction ability, if you say to them, "Oh, you're caught between a rock and a hard place," and they say, "Uh-huh," and you say to them, "Well, you know what that means?" And the patient says, "Well, I don't know. I mean, a rock is hard. Hard place is hard. So maybe it's about hard." So they cannot see the symbolic meaning, and we all know what it means, but psychotic people don't very frequently. Right? They have breakdown in their abstraction ability. Integration is the ability to organize your thoughts. Also damaged in very severely disturbed people. This is a painting by Dali of his wife, Gala. And you see, he actually put her hair as a forest. It was exploding. It's very commonly how schizophrenic people feel. It's how they think. So when they talk to you, they say something like, "Hi, good morning. I had eggs for breakfast. Oh, those are nice shoes. I think I'm going to go to a political rally. I watched television today, and I don't like the way this hospital does things." And so they can't stay on the subject. Their thoughts are very, very disorganized. When they get so disorganized that they're incoherent, psychiatrists have a fancy word for that. We call it verbigeration. Verbigeration. So next time somebody's not making sense to you, you can say, "You're verbigerating." All right. Self-preservation is another basic function. Psychologists see so many people who are suicidal, they kind of get used to it. And they forget really just how severe this is. To actually hurt yourself. You won't get in an automobile unless you believe that 99.9% of the people who are driving have a self-preservation function. They don't want to get killed. If you thought that 50% of the people wanted to get killed, you would not get in a car. So we rely on this self-preservation for ourselves and in other people. Very important function. Just think of all the time you spend washing yourself, taking care of yourself, going on. I'm on a diet right now, right? I mean, I'm trying to take care of myself. We spend time on our faces, right? We want to look attractive. All the time we try to spend being healthy. For somebody to want to really hurt themselves, something has to be really broken. I mean, you can be upset, but to cut your face. I had a patient once who stabbed herself in the face. It's horrifying. All right, so these are all indications that there's a breakdown of major functions. Right? There are about 21 other functions too, but these are the ones we use mostly in diagnosis. Now, besides the functions, we have these control and delay capacities that protect us and protect those functions so that they don't get burned up by emotion. So, for example, if you're very upset about something, you might not be able to concentrate and integrate your thoughts. That's pretty common phenomenon. Or you may feel like I want to die if you're depressed enough, right? It overwhelms your self-protection function. Well, what protects us from our feelings overwhelming us? Well, we have terms for these things, right? And they develop over time. One is impulse control. Now, this is an old joke. I don't know, maybe it's politically incorrect, but think about it for a minute. Who has the problem with impulse control in this picture? Now, when I saw this picture, I looked at it for about 5 seconds before I left. I looked at it and I said, what's going on there? And then I realized, oh, it's the guy driving the Porsche who had the problem, right? Because he got impulsive. He was looking at the attractive woman. Affect tolerance means containing rage, sadness, being able to function even though you have very painful emotions. And there's this interesting and important thing called sublimatory channels. Sublimatory channels means you're able to channel a fantasy into something productive. And here you have a little boy. This is a very famous painting by Norman Rockwell. It's called A Boy and His Dog, Mysterious Malady, Mysterious Illness. So you notice the dog has a little kerchief on his head, and the boy is pouring some sort of medicine into a spoon. He's acting like a doctor, right? Or a nurse. He's taking care of his little dog. Now, symbolically, what is this? Well, the dog, it represents a baby, and unconsciously, the boy is like his mother, right? So he's taking care of a baby. This is a channeling of the boy's wish to be a mommy. Of course, he can't be. Boys cannot bear children, right? No matter what they wish for, they're still not going to bear children, right? So he channels that wish into becoming a nursemaid or a doctor to the dog, which represents the child. So that's a sublimation. And a lot of doctors and psychologists and psychiatrists and other mental health people have sublimations like this that are quite healthy, right? We channel various wishes into this. Here's another interesting strength. It's the ability to regress and act like a child, right? We don't think logically. We give up our logical thinking in order to what? In order to relate to a little child, right? Now, I ask you, is the doctor in this painting? Here's a painting by Norman Rockwell. The doctor has put his stethoscope in the little girl's doll. Now, is the doctor psychotic? Right? He doesn't really think the doll has a heart, does he? Right. So what's he doing? He's playing. He's making believe that he believes that the doll does have a heart to calm down the little girl who's afraid of the stethoscope. Right? So he puts the stethoscope on the doll first to prove to the girl that it won't hurt her. He plays with her. That's a regression. That's adaptive regression in the service of the ego. That's what those letters mean. And that's a healthy thing. Another strength is the ability to keep dreamlike thoughts out of consciousness when you're trying to do something. Unless you're trying to make a piece of art or unless you're telling a joke. But other than that, dreamlike thinking should stay unconscious in your dreams or maybe in a daydream. And here's another Salvador Dali painting. And look what he put in it. Elephant with a horn. Those things don't go together. It's kind of a joke, right? But I mean, elephants have a sort of a horn. They have tusks, but here it's a real tuba. And this is called condensation, right? When the person takes two things that don't belong together and think about them together. Right? You also see symbolization. There's some symbolism here. He's trying to indicate somehow that man is connected to nature. All right, fine. Okay. So you have symbolism and condensation. So when those two operations act together, psychoanalysts call it primary process thinking, as opposed to logical thinking, which is not condensed. Right? This is a condensation and symbolization. All right. Now we get to object relations theory. We use object relations theory to explain why people don't have empathy, trust, and why they can't make commitments in close relationships. I bet you didn't know that we have a theory to explain this. What's commitment phobia all about? All right, well, here we go. People who have that have had some damage during their childhood, later childhood, or early adolescence. Something went wrong with their ability to form an image of themselves that's stable. In other words, a picture of themselves, I am me, and another picture of you, you are you. Instead, look at this painting by Salvador Dali. He captured it. They're afraid something's going to happen when they get close to people. So here's a ballerina in a death's head. She got close to her boyfriend and she thought this was going to happen to her. Here's the ballerina, see her arms, and here's her dress, right? But it turns into and gets fused with the skull of somebody else, right? Isn't that curious? So the dress becomes the teeth, her arms become the eyes, and so on. This is what people with borderline personality are afraid of. If they get close to you, they think that their image of you is going to get locked onto the image of themselves and they're going to die, right? The death's head. It's a very powerful anxiety. So they may like you, they can get close to you, and you know, after a week, they run away. Why did they run away? Because they have this kind, it's called self-object fusion anxiety. It's a nasty one. And it causes people to use a defense called distancing. All right, you can stop me anytime and ask me a question. Elijah, did you have a question?
Yeah, I did have a question.
You have to put your video on to ask me a question.
Oh, okay. Sorry. Not looking my best. But I just wanted to know, like, I feel like that's a bit like this example that you've given is a bit extreme, and I feel like I'm more familiar with like less extreme realities of this story, and I was wondering if you could elaborate more on.
Well, for example, what are you thinking about?
Like I guess for me, when I get into relationships, like I can really like someone and like make it known that I really like someone, and then over time, like even though I've formed like a great relationship with the person and I think like the relationship is going well, I can just like kind of feel like uneasy or uncomfortable in that relationship, nothing to do with them, and then it'll like shift, like it'll go like 1 week I'll not want to talk to them at all, and then the next week I won't want to like be around anyone else or something.
How old are you?
20. I'll be 21 next month.
21. Well, this anxiety in men usually disappears by the time they're 26.
Okay.
So there's a recrudescence of this kind of anxiety in adolescence. It's called identity diffusion anxiety, because we don't really have a formed identity as men until we're about 25. It takes a long time. Women used to form an identity a little bit more quickly, but for the past 10 or 15 years, it's been pretty similar between men and women. So even a lot of college women, they're not really ready to stabilize a relationship till they're about 23, 24. And in college, they have difficulty with it too. They'll fall in love with somebody and they'll have fantasies about marrying him. But after a month, they kind of feel trapped and they want to pull back and maybe date somebody else. That continues frequently until people in their early 20s. And that is a normal progression. If that shift doesn't happen by the time you're 25 or 26, then usually you have a developmental delay and there's a persistence of this type of anxiety.
Yeah.
When people have very severe, there are different types of defense mechanisms people use. Sometimes when people have this anxiety that they're going to get trapped and killed, they can still get into a close relationship, but then they'll move away from it and come back. Sort of like a ping pong ball. There are other people who never form any close relationships, but they have friends. They're like moons. They circle around you. but they only want to see you about once every week or two. You know, they don't want too much closeness because they want some. They want to have a relationship. They don't want this to happen. And then there are other people who get very intensely involved. These are the more sadomasochistic ones. They'll get involved with you and have a hot sexual relationship, and then they want to hurt you. So they oscillate between sex and destructiveness, right? Or they want you to hurt them.
And is there also
that enforces some distance, so they can feel like, oh well, I'm not really as close to this person. That's much more severe.
Okay.
So you're right. There's mild, normal stuff in late adolescence where you are. I mean, you're early adult, late adolescence. There's still some residual identity diffusion anxiety at your age. And for most men.
Okay, thank you.
Yeah. That clears up. Thanks for asking the question. It's a good question. Because we do see this in late adolescence. Although I've known people who got married when they were 20, 21, but if they don't grow their own identities together separately, they'll have trouble later on. And this is the old wives' tale, you know, oh, we were too young when we got married. Well, that's what it means. They were too young means that they couldn't tolerate the closeness. And they began fighting with each other to create distance, or they lost their love, they drifted away, and so on. Right? Now, this is not the only reason people have trouble in relationships, but it's one of the more common. And we also see it in people who cheat on their spouses. So they get close, they get married, and that's too close. They think this is going to happen. So they find the second person, right? And then they have an affair with somebody else, but they feel too close to the other person, so they run back to their spouse. So they have this like pendulum between the affair and the spouse, affair, spouse. I saw one woman who came to see me. She was all upset. She'd been having an affair with a man for 10 years. While she was married, she had a separate affair with a guy who was married to somebody else. She got upset when the boyfriend decided he wanted to leave his wife and marry my patient. That's when she had anxiety. Because then she couldn't maintain that distance and still have some closeness and distance. Okay. You can also get a little paranoia with this kind of stuff, because when you're afraid that somebody's going to take you over, like the woman in this very famous movie from the 1940s called Spellbound. It's an Alfred Hitchcock movie, also designed by Salvador Dali, by the way. The woman has a dream where all these eyes are looking at her, you know, and it's because of a problem with self and object fusion. All right. Another theory we use is about the superego. Right? The superego means fairness, ideals, reliability, ethics, lawfulness, integrity, guilt, honesty, trustworthiness, and shame. All of those things we lump together and we call it the superego. Right? It's really a shorthand term for all that stuff. Most of it's guilt and shame, and people can have damage to their superego. Like if you saw the show House of Cards, nobody has any guilt in that show. They're all a bunch of lying, scheming, untrustworthy people. And they kill people for what they want, whatever. I mean, everybody's, there is no redeeming character except for the one girl who gets killed and the one guy who tries to save her. But everybody else, no conscience. And here's the main character who says, of all the things I hold in high regard, rules are not one of them. What a guy, huh? What a guy. You really don't want to have him at dinner. And please don't date him. All right, now on the other, it's not restricted to men, however. His wife in the show is also has no conscience. And my wife introduced me to this TV show called Girls. And I had the same reaction. I said, oh, these girls have no conscience, right? They just do whatever they want. They sleep with whomever they want. They don't feel guilty. They don't feel shame. Nothing. No conscience. So it's an interesting modern version of people with no conscience. Not as dangerous, of course, just a phenomenon. And then you have the dangerous psychopath like Ted Bundy. You may not know about him. In the 1980s, he killed over 30 women after seducing them. And he didn't look the part. Look at him. He doesn't look like a grotesque murderer. As a matter of fact, somebody married him while he was on trial. And she didn't divorce him until he was convicted. Then she said, oh my God, it's true. Yeah. And this is what he said about murdering women. He said, you learn what you need to kill and take care of the details. It's like changing a tire. The first time you're careful. By the 30th time, you can't remember where you left the lug wrench. Very callous dude, huh? No conscience. So we have to be careful in assessing people to make sure that they're not lacking a conscience. Because if they're lacking a conscience, or they're like the guy in House of Cards or Ted Bundy, we can't treat them. They're too dangerous. All right. Now, what about treatment? If somebody has damage to their abstraction and their ability to integrate and use reality testing, then we give them antipsychotic. There's something called an antipsychotic medicine. You may have heard of them. One of the more recent ones is Seroquel, but there are others like Haldol, very famous. They're very dangerous medicines. They all cause Parkinson's disease or diabetes or something. But about 40%, they relieve the damage to reality testing, 40% of the time. Not great therapeutics for people who are psychotic. I'm sorry to tell you that. I wish we had better treatment. If people have weakness, right, like their impulse control is bad, they're using too many drugs, they're getting into fights, sleeping with 30 or 40 different people and not enjoying it anymore. Well, we can give them advice. They probably won't listen to it. And one of the more useful techniques is to have them in group therapy with other people like them and help them express their feelings and identify their weaknesses without shame and accept support and help from other people. This is one of the things AA does, Alcoholics Anonymous. The first thing they do is they confront the person. They tell them, oh, you are an alcoholic. You have a weakness. Accept it. Get rid of all the, number two, get rid of all the alcohol in your house because you're going to be tempted to drink it. Face the fact that you have a weakness. And and then get into a group where you have a sponsor and somebody to talk to when you're upset instead of drinking. Okay? And they have about a 10% rate of success because most drug abusers are very difficult to treat. If people have problems getting close after they're 25 years old, right, and they can't sustain a relationship, then we have to confront them about that, show them that they're using a way of distancing themselves from anxiety that's not real. Nobody's really going to take over their mind. That's left over because something bad happened to them before they were 3 years old or during early adolescence. Right? And they're left with this kind of problem. And this happens also between the therapist and the patient. And of course, if people have defects in their superego, if they don't feel shame and guilt, refer them to the local prison. Now, there are people where their ego functions of, integration and reality testing are fine. They have pretty good control and delay mechanism. They can form empathy and love for other people. And they do experience ethics and values and a sense of guilt. They can also have problems. These problems are very treatable. And they involve phobias, panic attacks, obsessions and compulsions, depressions, and conversion symptoms. Conversion symptoms where somebody has a physical symptom that's not based on anything physical. If they don't have damage to all those other functions, then we can use psychoanalysis. We can try to figure out what is the conflict that's causing them to have the problem. What is the compromise formation? Remember that? And here's another way of looking at it, the wishes versus superego factors in reality, right? creating affects and defense mechanisms like forgetting things and shutting off your feelings, which is called isolation of affect, or maybe denying reality, not seeing reality, or projecting, blaming somebody else when it's really your fault, or having an expectation that somebody's going to be like your mother and father unconsciously. That's called transference. All of these things together produce what used to be called neurosis. Now, neurosis has been erased from the club that calls itself the American Psychiatric Association. The American Psychiatric Association is not a sanctioned official body. It's a club. It's a society, it's a club of psychiatrists, and they got together and they put out this manual that they thought was pretty neat. It really is a mess. The DSM-5 has some benefits, but it's really just a hodgepodge. And if you want to read my criticism of it, it was published a few years ago in a journal called Psychoanalytic Psychology, about 7 pages. And I started by saying the Diagnostic and Statistical Manual today is neither diagnostic nor a manual. All right, I go on from there. So if you'd like to read it, ask Dr. Myers, I'll send you a copy. All right. But in any case, neurosis does exist. There are these symptoms and also personality problems that are based on compromise formations. And here's a much more complicated way of looking at it, that a current day conflict, which produces emotions, normally should be resolved by using language and logical thinking, right? So if you have an argument with your wife, right, and let's take a situation where a woman has gone through IVF and failed. So she has no children and she can't get pregnant. And she keeps failing at IVF. She gets very depressed, stops talking to her husband. Now her husband normally should use speech and language and talk to her and say, hey, come on, let's talk about this. We have to grieve. Maybe we'll adopt a child, something. Let's think it over. But the husband has problems of his own because he grew up in a situation where his mother was always talking and he couldn't stand it. So he doesn't like talking to so much, right? So when his wife is moody and she's depressed and she's not talking, he doesn't talk to her. Instead, it reminds him of the unconsciously, his wife starts to remind him of his mother. He doesn't know that. And instead of talking to her, he gets online and he finds another girl. I mean, a girl in college, and he goes over and has sex with her. That was his solution to the problem. Not a very good solution. Of course, his wife found out and they had a big fight about it, right? Very typical kind of patient who comes to see me, right, when they're in the middle of a mess, because there was nothing wrong with his superego. He felt guilty as hell about it. He had otherwise good control. I mean, he had a good job. He controlled himself. And his ego functions were okay. He knew the reality. He could organize his thoughts. And he loved his wife. He was close to her. It wasn't a problem with closeness. The problem was a conflict in the current day that triggered off all this repressed stuff. And he started acting weird, right? And he did weird things. So he started getting, right? So that's one way that psychoanalysts look at normal people who should know better, who get themselves in trouble, they make mistakes, or they develop a symptom like a phobia or a panic attack. What do we do with people? What does a psychoanalyst do today? Well, if they have all these 4 functions working here, then we can tell them, all right, well, tell us about your thoughts and your feelings and your dreams, whatever. And I'll try to help you understand it. We can ask a few questions. Analysts don't ask too many questions. We mostly wait for people to tell us things, and we clarify for them what the conflict might be. If they're using a nasty defense, like cheating on their spouse, I might say to them, doing that hurt your wife. You were trying to solve your depression by doing that. And that's a pretty lousy way of doing it. Let's think about why you did it and what caused it. And we finally see, yeah, he was depressed and his wife reminded him of his mother. Yeah, okay. We look at their defense mechanisms like rationalization, making excuses for themselves, or maybe coming up with some harebrained theory, which is called intellectualization, and how they forget things and run away from painful situations, right? If they have resistance to treatment, then we have to discuss that too, because a lot of people don't want to see a therapist. They feel ashamed. We have to discuss it. They're ashamed. Why? Because they see us as parents, believe it or not, and they think, oh, well, I grew up already. I don't want to talk to another parent who's going to give me advice. I don't want some person to give me homework like my teacher. So they resist. They miss appointments. They don't pay the bill. They don't tell you stuff. Right? And we have to find out why they're doing that. This is analytic therapy. Of course, in CBT, it's the opposite. Right? CBT, you do give people homework and you try to tell them how to think. Analysts don't do that. We try to understand why people have resistance, and we try to understand how that's connected with their problems. Right? If they have a dream, we'll try to understand the symbolism of the dream, what it means, and we look for links to various things. Okay, so that's the end of the lecture for today. The rest of the time, I set aside so you can ask me questions. Right?
And just really quick, while you're thinking of questions, I do want to let you know that in previous years, Dr. Blackman has gifted me his books. And so we have the 101 Defenses that he mentioned. We also have the Therapist's Answer book.
Okay.
We have Getting the Diagnosis Right. And we also have Sexual Aggression Against Children. So if the person you're doing for your case study happens to be a pedophile, that might be a really great one. So, and I would love a copy of that most recent article because I also have problems with the DSM and I would love to see your opinions about
I'll send it to you, Taryn, sure.
Great, great.
Yeah, all of us have trouble with the DSM-5.
Yeah. Anything that's made by committee, right, is going to end up problematic.
This is a committee of over 1,000 people who didn't agree with each other. So it's a political document.
Yeah.
Right.
What questions do you all have for Dr. Blackman, either about any of the points he raised or about his experiences as a psychoanalyst?
Yeah, I'll be glad to answer anything. And if you don't ask me a question, I'll tell you a story, but you're going to have to keep listening to me talk.
Actually, I'm just curious, have you moved to doing digital therapy at all?
Yes, 99% of the time.
Yeah.
I still have an office and I still have 2 patients I see there, but yeah, they're all vaccinated and whatever. But yeah, most people, it's more convenient for them to see me online.
Makes sense.
Well, maybe you want to hear a story?
Sure.
Please put on, it feels funny to me talking to a black screen. Why don't some of you put on your video so I can see you? Yeah, hi Elijah, it's good to see you. Nobody ever, yeah. Mayana, is that right? Hi, Susan, hello, nice to see you. Erin? Good, okay. But you don't have a question. You don't have a question about was it commitment fears?
I guess I have a question.
You have another question, Elijah? Sure, ask me.
Yeah, so like the last slide, like neurotic illnesses, and you were talking about like I guess normal people. What if you were able to like acknowledge everything? Like if you could acknowledge that you were having some conflict in like like in your current situation, like and I knew how I would respond, like and I knew that it was a negative response, and I was able to acknowledge all of that and
Right.
go through the whole thing and be like, yeah, this is a bad thing to do. I shouldn't do it, and then still do it.
Yeah, well, then you have to see what the unconscious reasons are that you're persisting, even if you understand. Usually people who understand what they're doing and they do it anyway, they may be using an interesting defense mechanism called undoing. That means they know they shouldn't be doing something, but they hate their conscience. So they can't let their conscience be their guide, because their conscience unconsciously is associated usually with parents or grandparents who told them, don't do this, don't do that, don't do that. So they've got it in their head. They've identified with their parents. They say, don't do this, don't do this. And they get so sick of it, they rebel against their unconscious. And they'll do things that they shouldn't do and sometimes get in trouble. And they get the outside world to punish them instead of themselves. So instead of feeling guilty, they get punished by the outside world. Somebody punished them.
I guess like going off that as well, like I feel like now, especially like with social media and things, that you get a very persistent like intake of societal norms and like what people would suggest that you do, and if that would influence your conscience and you already disliked your conscience, would that be another reason to like rebel against it? If you're like, okay, well, society would be like, this is bad to do, but you know, like F that and then do it anyway. I don't know if that was dumb, but
Well, when you get into social things, it's very complicated because they're reality factors, you know. So that's harder to analyze. But you do see people who will, I think, yeah, social media does affect people. It affects their conscience. Um, there's an interesting show I saw recently. It's called The Tinder Swindler. The Tinder Swindler. It's kind of interesting. It's about a guy who figured out how to use Tinder, and he swindled $10 million out of hundreds of women.
oh, I saw that, yeah.
Yeah,
Well,
it's a true story, actually. And the women were not suspicious enough. I think a lot of the women, at least that they portrayed, seemed to be like normal women. One was not. One was, I think, impulsive type of person. But the other women seemed normal. And they got sucked in by this faker. Why? Well, because the whole Tinder culture, right? You don't have time really to get to know somebody in their context, right? So you can get very pulled into that. But other situations are like cults, for example. People can get drawn into a cult because they're looking for a mother or father that's wonderful, right? Or they're rebelling against something at home that they hate, and they'll identify with a cult leader, like Reverend Moon, for example, you know, to become a Moonie. How does that happen? You know, well, it happens through conflict, right? The resolution of conflict. I treated a guy once who was having trouble meeting women, a young guy, and he had read a book called The Game. And this book supposedly tells men how to meet women, right? But it's essentially a pickup artist thing. And of course, it didn't help him, right? And if you're not genuine when you talk to people, they figure it out pretty quickly. So he was being a phony, and he was trying to fake his way with women, and he had no effect at all. So he came to see me, and he was trying to use this book called The Game. So he was influenced by media, in other words. He was influenced by something he read. So that can destroy people's genuineness and their object relatedness, their capacities for, if they don't think being empathic and kind and thoughtful about people is a good thing to do, their conscience may tell them, well, you shouldn't do that anymore. You should be callous and mean, or you should use pickup lines or something. Yeah. So I've seen I mean, propaganda was supposedly invented by the British during World War I. And it's a remarkably effective tool. A lot of people seem to be, I'm not a specialist on it, but you do see it. It's all around us. It's very, very interesting phenomenon. Maybe you can study that. There's an interesting book. It was written, it's called The Making of the President, 1968. It's about how Nixon got elected. And it's all through smoke and mirrors. The Making of the President, 1968. I forgot the name of the journalist who wrote it. It was a very clear depiction of all the propaganda tools that they used. You know. And of course, Nixon turned out to be kind of Looney Tunes. I mean, weirdo. Watergate and all that stuff. So, all right. So any other questions? That was an interesting question about social media, the effect. It can affect people's superego too. It can affect the way their value system may be. I found the positive side of social media is the humor. Because during COVID, I got like hundreds of jokes from my friends, which was really good. I mean, it was a depressing time, you know. And I get a meme, you know, of a Corona bottle, you know, and it said Corona Extra on the beer. And the caption was, now you know what the extra really meant, right? So I mean, the internet has its good side. But also the difficulty with political propaganda is pretty severe. We're living with that. All right, any question about
humor? I was actually wondering if you could speak to the use of humor in psychoanalysis.
Oh yeah, well, it can either be a help, or it can be a defense. So one guy, I walked in one guy, this is about 20 years ago. I was treating a guy in his early 30s who was having a lot of trouble with women. And I come in one day and he's going like this. What's up, Doc? What's up, Doc? He did it better than me. It was Bugs Bunny. Do you guys know who Bugs Bunny was? Yeah, okay. Well, he was very good at doing Bugs Bunny, and I really cracked up when he saw it. He was making fun of me, you know, but it still was funny. And I said, "That's very funny." You know? I said, "Yeah, are you really in a good mood? You feel like kidding around?" And he said, "Well, not really." Then he told me the latest tragedy with some girl he dated. So he was using humor to protect himself from feeling depressed. On the other hand, humor can be used as insight. So one woman I'm treating, what did she say? We were talking about her conflicts because she's married, she has children, and she has a very demanding job. She's a professional person, so is her husband. And they're having some problems. But anyway, we were talking about this conflict that she has about leaving her children to go to work. It's very hard for women who are working to leave their children. It's always a conflict. And she said, you know, Germaine Greer said that you should be the doctor who you used to want to marry. If you're a woman, you should be the doctor. Don't marry the doctor. But she says sometimes she feels like she is a doctor. She said, sometimes I feel like I'd like to be the woman who married the doctor. Now, she was kidding, but the joke was very important because it showed both sides of her conflict, right? In some ways, she wanted to be a doctor and work hard. In some ways, she didn't want to be a doctor. She wanted to stay home and be a full-time mother. So she was having a lot of conflicts between those. And in that sense, her joke was a useful way for us to conceptualize where the problem was. And she was having trouble handling it. All right. So humor can have various uses in treating people. If somebody tells me a joke, while we're working together, I almost always stop them and say, that's an important joke. Let's see what it means. The psychoanalysis is all about understanding what things mean, right? What's the unconscious meaning? Is it a defense? Is it a way of them communicating something to me? Yeah. All right. Do any of you know a joke that you would like to tell us? I like jokes. I collect jokes, actually. But you want to hear a joke from 1960? I collect vintage jokes, old jokes. The joke from 1960. You ready? I'll tell you the joke and you tell me what the conflict is, all right? It's a senior prom. A guy comes to pick up his girlfriend, but she's not ready. So the girl's mother is talking to the guy. He says, are you going to college next year? Where are you going to college? And she says, by the way, she says, do you screw? The guy goes, what, Mrs. Smith? She says, I just want to know, do you screw? He says, well, I mean, I don't know how to answer that, you know. And so meanwhile, the girl comes in her prom dress, and mother says, mother, look, the girl's kind of confused. And as they're leaving, the mother says, well, Diane, have a good time. Joe here says he doesn't screw, so I don't know. And the girl turns around and says, mother, I've told you 1,000 times, it's the twist. For those of you who don't know, that was a dance in 1960. What's the conflict? The conflict is between the mother and the daughter, right? The mother wants to know what the daughter is up to. She's invasive. And the daughter is furious about it, right? The mother then develops a reaction formation. She tries to be nice about it, but she's really not very nice. She's sticking her nose in where it doesn't belong. And finally, the girl gets angry about it and corrects her mother. So this is a joke about how mothers will ask, you know, superficial questions, but they're really curious about the sex lives of their children and how that impacts on the girl, right? I hope that wasn't too shocking for you. I figure you all have looked at 4chan, so I figured that joke was pretty mild. All right. Let's see. I can tell you another joke. It was told to me by a man who was cheating on his wife. He was a misogynistic guy, right? And this is the joke he tells me. He thought women, he didn't see women as individual people. So he had a wife, but he was cheating on her. He also went to prostitutes, and he was a mess. And he said to me, you know, but if his wife asked him to do anything, he would always do it. He would say, yes, dear, yes, dear. So she would ask him to take out the garbage at night after dinner. And he said he would take out the garbage to the backyard. He'd put the garbage in the dumpster. But on the way back to the house, he would stop and urinate on his wife's flower garden. What do you think that meant? Mayanna, what do you think that meant? He would do what his wife told him, but when on the way back to the house, he would stop and urinate on his wife's flower garden.
Would it be like showing that he doesn't really like doing all the things that she would ask him to do?
Right, exactly. Exactly right. So when he did what his wife asked him to do, he was using it to defense. He didn't really want to do it, did he? And that defense is called passivity. He got passive with her. It's interesting, right? But when he urinates on her flower garden, It's hostile, right? Pretty hostile. You have any other thoughts about how, Griffin? Do you have any other thoughts about the symbolism there?
I mean, I just kind of thought like just like a representation of like resentment, kind of, you know, like he'll do it, but just,
What makes you think,
you know,
maybe he just had to urinate? What makes you think? It's
I mean, if I had to guess, she probably took pride in those flowers in that flower garden, like, you know, something she cared for, something that held personal value to her. So it's kind of him, just kind of like a, I don't know, like a kind of in my mind, I think of like kind of like a screw you kind of thing, like just, you know, I'm here, but not because I want to be, like, just,
yeah, all of the above, all of the above. Yeah, symbolic. It was a symbolic act, wasn't it? He was expressing his hostility. He was pissed off, so to speak, right? And now I later in treatment, I found out why. When he was in college, the girl he later married was dating one of his fraternity brothers. And when they broke up, he asked her to date him. But she didn't. Instead, she dated the womanizing psychopath. And he told her, don't date that guy. He's a louse. He's just going to use you and abuse you, and then he's going to dump you. Don't do that. But she didn't listen to him. She dated the louse anyway. And sometimes he would see her going into the louse's bedroom in the fraternity house, and they were laughing together and shut the door. He was witness to that. But by the next term, when he came back, of course, the louse had dumped the girl. He had used her and abused her, and she was very upset about it. And she came to him and said, you were right, I'm sorry, you know. And then she agreed to date him. They dated for 2 years and they got married. And he felt great. He felt he had won, right? So they got married. And 20 years later, she told him, if you don't give me a third kid, I'll stop having sex with you. And at that point, he started going to prostitutes. And he also started urinating on her flowers. Very complicated situation. So we had to take all this apart and see what had affected him. So the urinating on her flowers wasn't just because he was taking out the garbage. He was also still furious about something that had happened 20 years previously. That really was not her fault and was not his fault. I mean, he was dating somebody else too. But he was really irritated by having to watch her go into this other guy's room. So you can get a peek into how the past can influence the present, right? Well, I hope that's not too shocking to you, but that's the kind of stuff I hear in my office. And I'm disguising this. I'm mixing up about 4 or 5 patients when I tell you this. It's not just one guy. So, but I'm using it just to teach you as an example. I'm putting some things together that sort of fit together from different people. But he told me a joke. And we'll end with this, I guess. The joke was, remember, this guy's a womanizer, right? He's going to prostitutes, he's mad. But part of it is because he's mad about what his wife did to him when they were 19 years old. So he tells me this joke. He says the guy comes out of the, you know, playing handball or something. And he comes into the locker room, picks up the cell phone, says, hi, honey. And you hear him say, the new Mercedes, you mean the one that's $120,000? He says, sure, go ahead and get one. Oh, that $50,000 necklace? Yeah, sure. You put it in a bag and save it for your birthday. Oh, that house that's $4 million on the water? Yeah, put in a bid right now because houses are selling. He says, okay, I love you too. And he closes the phone and he looks around. He says, whose cell phone is this? This is his idea of women, right? And I tell them, I said, yeah, that's sort of funny, but the way you view women is as extractive people who don't have any personality. And that's kind of condescending view, right? And it masked a lot of his hostility towards women to tell that joke. You see how it fit with the rest of his problems? So we could put the joke, his joke, together with the rest of his problems. Okay, well, I hope that's been interesting to you guys. Dr. Myers, thank you for inviting me to talk.
Thank you so much for coming and giving us such an insightful talk. And if anyone, wants to reach back out to Dr. Blackman with questions, I have his contact information and I'm glad to share.
Absolutely. And I'm going to make a note to send you the article on DSM-5.
Yeah, I'd really appreciate that.
You can share it with the class if you like.
Okay, great. Yeah, we'll be talking about diagnosis in a couple weeks, so that'll be perfect.
This will be the contrarian view.
Well, they already kind of get that from me. So
Okay, you all. It's good seeing you.
all right. I will see you all Tuesday. If I don't see you the rest of the day, have a great weekend.
All right. So long, everybody. Stop sharing.